Good morning, and thanks for joining us on The Real Story. I'm Jen Bernstein. Well, the cavalry is here. Vaccine distribution has begun in Connecticut. Our frontline healthcare workers and our nursing home residents getting the protection they need and beyond deserve. Now the question is, how many people will take it when it becomes available? Our first guest this morning, the CEO and president of Hartford Healthcare, Jeffrey Flaks. Thanks so much for doing this.
Thank you.
All right, so let's talk about the moment when these shipments of the Pfizer vaccine came in. That must have been incredible to witness and be a part of, as, you know, being in the healthcare industry and watching the doctors and nurses who need this battle this for months.
Jen, it was hard for me to really even to describe it. It was absolutely an extraordinary moment. I referred to it as the dawn of a new day. You know, for 9 months, it was just 9 months ago exactly, nearly on March 13th, where we had our first patient. And to imagine 9 months later that we could be sitting here seeing our same frontline staff members who took care of that first patient getting that vaccination, and again, showing the courage, being an inspiration for our community, stepping forward and role modeling by getting that vaccine and showing their faith and confidence in the science. It was a historic moment for us to be part of and to witness, and unbelievably gratifying.
I was very taken by the fact that doctors went on in front of cameras and got those vaccines, because that's so important. It's walking the walk, as one of your doctors said, and talking the talk and making sure people understand that if we're asking you to get a vaccine, we're going to get one too. Tell me how those doctors, nurses, and frontline healthcare workers are feeling right now.
Jen, you know, some of our physicians described it, that it's a comparable feat for this country as putting a man on the moon. I mean, they said to imagine, when you think historically, that it would take years and years and years for vaccines to be developed, to have a vaccine in 9 months be created for a virus that never existed before, and to have it be 95% effective, is an extraordinary accomplishment. So we had so many people volunteer and people committed to doing this and to helping communicate and lead within our communities, that they're feeling really well. We monitor everyone very closely. They're feeling so enthused by the opportunity to do this and what it really means, because it's going to protect all of our patients, all of our community, particularly our populations who are most vulnerable. So we just can't get it there fast enough, and that's what our focus is today.
And so far, no side effects, or have there been just minor side effects, like swelling in the injection area, that kind of thing?
Yeah, very rare. So the vast majority of people, we've had about 500 people at this point, and more coming every day, get vaccinated. So when we look at it, the vast majority of people, without exception, have done very well.
So what are the vaccination plans moving forward? You know, how many people do you plan on getting vaccinated within your healthcare system, and how long do you think that's going to take?
So we plan to vaccinate. We have 33,000 people who work at Hartford Healthcare, and we're working through a process to vaccinate everyone within our system. So we are vaccinating now, and we've created quite a process and a capability to do so. So we're going to be vaccinating thousands of people a day within our system with the model that we've created. So really what's critical for us is how fast we can get the vaccine. And then we do have to administer it twice, depending which vaccine people take and at what the interval is. So it's going to take us probably until the middle of January, possibly till the end of January, for us to get through the vast majority of our organization. And certainly by the middle of January, the people who work most closely on the front lines of our operation, most where our patients are, will be vaccinated.
And if they got the first shot and then they get exposed, which I know that they're exposed every day, they wear the PPE, they try to protect themselves, though, does it help once you get the first shot? I know you need the second shot to have real, you know, the vaccine really work, but after the first, does it give them some defenses?
It does. It does. So there are indications that they start to develop fairly quickly, some protections, which we're very encouraged by. But at the same time, Jen, you know, the vigilance that we will maintain within our facilities around how to be careful, not to spread infection, not to expose our patients, not to expose our staff members. Our processes are absolutely critical, and we do everything possible to maintain that vigilance. And it's one of the ways, Jen, we're going to be better than normal. You know, there's so many learnings throughout this crisis, but but a lot of the work that we've put in place around really able to protect using personal protective equipment at levels beyond what we've ever done before, and procedures we've put in place on our different parts of our hospitals and all across our health system are going to make us really safer when we emerge than we've ever been.
How is our PPE supply? Because that was such a big deal, obviously, in the spring. Is this still a concern at this point as we're going through this next real wave this winter?
Yeah, I'd never want to say it's not a concern, but at the same time, we've built up quite a stockpile here, as all of my peer organizations across Connecticut have really worked to do so. We're just as we speak. We're just taking over a new warehouse that we're going to be opening in central Connecticut, 50,000 square foot warehouse, because we've acquired so much PPE, we've completely outgrown our traditional spaces. So for us, there are certain particular segments of PPE that at any point in time might be more difficult to get. But we're working hard to build a very significant inventory, and in some cases we have up to a year's supply at the present use rates. And probably the areas where we have most vulnerability, we might have 80 days or so, in that range. So we're pretty well situated, but we're never comfortable, and we certainly are working hard to acquire as much as we can, particularly in the areas where we know there's certain shortages across the world.
Does this change your mindset for the future on what you want to have at hand? I mean, this is obviously the current pandemic, COVID-19. There will be at some point in the future another pandemic, we know, just history-wise. Does it change the way you think about it?
Completely, Jen. It's interesting because it's one of the areas I keep talking about. We're going to be better than normal. In healthcare, we spent years working towards having just-in-time inventories and trying to measure efficiencies on trying to turn inventory as quickly as we could, because that would be the most cost-effective way to manage inventory. But I just took a 50,000 square foot warehouse in addition to all of our existing warehouse capacity because we don't see this going away. We're going to maintain up to a year supply at surge levels of all of our critical PPE, because we're not going to find ourselves in this position. And, Jen, I hope at a national level, think historically we had reserves in place for oil if our oil supply was ever disrupted. But at the national level, we never had reserves for PPE. And I'm comfortable that, and I know Congressman John Larson, our entire congressional delegation are sponsoring legislation to work towards getting a national reserve in place. And we'll never find ourselves in this position again, hopefully, but I could certainly speak to Hartford Healthcare, where we're building a very significant on-site reserve, and we think it's going to be best practice.
No, that's really smart. I want to talk to you about this alternative care facility that you're rebuilding, right? We had one of these in the spring at the Connecticut Convention Center. You're partnering with the state again. You're partnering with the National Guard. It's 600 beds. You're resurrecting it. Tell us why. Is the ICU a problem right now, or is it just to make sure you have enough padding as we continue on this? I know I keep talking about the curve, but that's what we're in right now.
Sure. First, I have to commend Governor Lamont. It's the right thing to do. I think it's a smart thing to do. This is about preparedness. It's about leveraging the resources within the state, and specifically the National Guard, who actually works as our partner in setting up this temporary hospital setting at the convention center. We don't need it today. And I'm hopeful that we will never need it. But in the event we need it, you don't want to be building it at that moment. You want to have it well set up and prepared. And we have to install our electronic health record. We have to install our medication distribution systems, all types of smart pump technology, various equipment relative to oxygenation. So this is the right time to set it up while we can do it thoughtfully, planfully. And if in the event we need it, we can very smoothly start using it. So today we don't need it. We've been very fortunate. We have, in our systems today, we still have, probably about 70% or so of what our peak volume was when we look at where we were in the spring. So we haven't gotten to that point yet. And it's a different circumstance, Jen, because today many more patients are not requiring critical care. So in the spring, critical care was really the most rate-limiting factor within the hospitals. And up to this point, proportionally more patients are being cared for in traditional, what we call medical surgical beds, our floor beds. So right now, we're able to manage through this. We watch it every day, but we feel much more comfortable. We think it's a very good insurance policy to have in place. And again, I recognize the state who throughout this crisis has been willing to do whatever it takes to make sure we're as prepared as we can be. And that's really what setting this up is all about.
So how full are our ICU beds at this point? You're saying they are not reaching the levels that we saw before. It sounds like we're getting smarter about how to treat these patients. Is that what I'm hearing?
There's been incredible innovations. I mean, the ingenuity. I marvel at our physicians, and I marvel at what's happened in medicine. Again, they were encountering something they'd never seen before in a brutal situation with this virus. And over a period of time, they've developed, new medications, new regimens of medication, new ways to manage patients that has resulted in less requirements for ICUs. So, across the state, you'll see ranges from ICUs probably from 65 to 70% occupied up to upwards of 90%. And each day of the week matters. Some days of the week predictably have higher ICU utilization than others. But all people within all health systems today are watching it carefully. And we can adjust different things that we do within the institutions if necessary, and those decisions get evaluated literally each and every day.
We're in this whole new world right now with the vaccine, and that opens the door to a lot of other unknowns. Will the right amount of people decide to get the vaccine, even if it's healthcare workers or just the general population? If you have COVID, are you supposed to get the vaccine? I think they are encouraging people to still get the vaccine. My question as well, and I'm curious about this, is has anybody been hospitalized twice for COVID at this point that you all know of?
Not specifically, not that I'm aware of as it relates to COVID, but we've certainly had people who had COVID who might come back for other purposes. But I'm not aware of any person, at least in that's presented with an HHC, who came back for COVID a second time. But this vaccine is a tremendous accomplishment, and we're working closely with the government. We're working very closely both at the state and federal level as we work to prioritize. And we're pivoting within Hartford Healthcare. I mean, we've been incredibly focused on testing. We've done over 550,000 tests, which has been our primary focus, and that will continue to be essential. But now we have to stand up an entire new operation that can allow us to go across the entire state to deliver safely the vaccine. And that requires a whole new set of processes to do it properly, to do it safely, and to have kind of the right support systems in place to ensure that. So this is a great moment, and it's a moment that we've been so anxiously awaiting for, and it's going to take us some months, obviously, as it rolls out across our communities as a whole.
Yeah, when do you think we can start seeing a difference in those COVID numbers with this vaccine going out now? I know, obviously, there's a lot of factors, but what's your prediction?
Well, this time of year, during the holidays, it's so critical that the vigilance people continue. Because right now, the most important thing we can do is social distancing, wearing a mask, hand hygiene, being really responsible around travel in social gatherings. That's most critical. The vaccine is going to start to emerge within our communities when we get into, we hope into that late January, February timeframe, March timeframe, and then starts to roll out across our communities. And, there are variables in terms of what its acceptance will be and how quickly we can get the vaccine that has to come, through a coordinated federal process. So right now it's about vigilance, ensuring vigilance. And then as soon as that vaccine is able to be broadly distributed, we certainly will do so, and we'll do it as fast as we possibly can.
All right. Appreciate your time, Jeffrey Flaks, CEO and President of Hartford Healthcare. Thanks for being on The Real Story today.
Thanks so much, Jen.
All right. You be well and be healthy.